You're a member of the Tea Party caucus. You have said over and over again, as other people have, that the reason you've come to Washington is to reduce our deficit and reduce our debt. I assume you're very well aware of the vehicle that is being used to repeal the Affordable Care Act. This is not some small piece of legislation. This is the Republican budget.
Yes. I'm aware of the bill, yes.
So do you support a budget that increases the debt by $10 trillion?
No, what I support is an opportunity to use reconciliation to address the real challenges in the Affordable Care Act and to make certain that we put in place at the same time a provision that allows us to move the health care system in a much better direction.
Do you support the budget that was passed by the Senate Republicans?
I support
to repeal the Affordable Care Act that adds $10 trillion of debt to the budget deficit.
Well, the reconciliation bill is yet to come. I support the process that allows for and provides for the fiscal year 17 reconciliation bill to come forward.
Will you commit today that any replacement plan for the Affordable Care Act will not in any way contribute to our deficit or our debt?
I commit to working with you to make certain that that happens.
Will you commit, as a member of the Tea Party, that no replacement for this dreadful Obamacare that allegedly created this deficit and debt will add to the deficit and debt? Will you commit to that? Can't you tell the Tea Party you're not going to increase the deficit by repealing the Affordable Care Act?
There are a lot of contributions to the debt and to the deficit,
well,
as you know, Senator.
That's true, and you and I talked about that briefly.
Right.
Are you going to allow the repeal of the health care bill to be one of those contributors to our deficit and to our debt? The CBO has said that repeal of the health care law could increase our deficit by up to $353 billion. Almost the entire theory of the case here, I think, from the Republican Party on this subject has been that the health care law has increased costs, that the health care law has increased our deficit, increased our debt, and I would hope that you could take a pledge today that would say that nothing that you would advocate for would pass or have the President sign into law, the President-elect sign into law, would add $1 to our deficit or our debt.
Well, I certainly hope that's the case, and again, look forward to working with you to ensure that it is.
Thank you, Mr. Chairman. I yield back my time.
Thanks.